My name is Charles North, and I own a small business here in the town of Lewisburg. My wife and I have been working at it for 25 years. I also lived in Washington, D.C. a good portion of my earlier life and learned three things I quote quite often. Herman Goebbels said, as you remember, he was Hitler's advancement. He says, tell a lie, make it a big one, repeat it often until it becomes the truth. The best president I can recall, said that if you cease to tell the truth will no longer exist. One I hold true to as a small town pastor. If you see, in order for evil to prosper, it takes good people to do nothing, and these are good people. What this boils down to, as far as I can see, is trust. Now, our illustrious governor here has decided that since he can't meet the budget, he wants to raise our personal income tax by 16%. He wants to raise other things in our lives as well. As a small businessman, and seeing that coming down the road here, cap and trade, coming down the road here, we have this healthcare issue, which I have a lot of issues with. I know a lot of people here have more information about than I do, but as an attorney, as a businessman, we're supposed to read before we sign. As a businessman, I want to know what's the government going to start cutting back on their expenses, because you're asking me to
I supported the constitutional amendment for a balanced budget. And I voted for the balanced budget amendment and also for the line item veto. And I sense, as I said in the opening statement, a tremendous public concern in America about all the money that we're spending. And that impacts on cap and trade, which I said. And it impacts on the healthcare system. And there's a lot of concern to try to live within our means. And on the healthcare issue, the president has made a commitment that he will not sign a bill that adds to the deficit. I know there's a lot of skepticism. Well, I was on the Senate floor and made a long statement about this as to areas of saving where we're going to cut down. With research on the National Institutes of Health, you're able to cut back on mortality, on stroke, and many maladies, and that saves money. Lifestyle saves specific dollars. Cracking down on crime, white-collar crime, saves money. Stopping chronic ailments saves money. Taking people away from the emergency room saves money. And we're struggling now. We don't have the bill, but we're struggling to have a bill which will meet what you want.